Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and I'm a PT assistant. Today, I am interviewing RT Hill and Niraj Vora from the Stride Shop. Both are physical therapists, and they own a running clinic in Baton Rouge and New Orleans, Louisiana. So we are going to talk about different running injuries and how to work through them and different exercises you can try to fix these problems. So without further ado, here are the gentlemen from the Stride Shop. We're going to talk about IT band syndrome now. So I kind of have a tight IT band, so I guess this relates to me too. So what is your approach to IT band syndrome?
Yeah, I mean, IT band syndrome again is one of those things that's I think probably approached in a million different ways if you walk into a PT clinic, and I think that there are things that people are like, you should never foam roll. Other people are saying you should always foam roll, and you should stretch your IT band, or there's no way to stretch your IT band. It's useless. And I think that's fine. And we're very much evidence guided as opposed to this is what the research says, so that's the only thing we're going to do. I myself have gone back and forth between foam rolling, not foam rolling, foam rolling. It's pretty painful, and sometimes it's useless. But I think it has its place. If we can do something that it's helpful, I think we should absolutely use it. But really, I think we're going to approach it the same way we do most injuries to start. You get a great history of what has led to this. Has something changed in your training? Do we need to adjust volume or intensity or frequency? Do we need to adjust your surface? Have you been running a ton of downhill? Or have you just recently changed surface where you moved and now you're in this hilly place and all of a sudden you don't have the tolerance for it? So
running a track in one direction, the whole time, right?
Yeah,
running on the street on one side.
Yeah, and so you take all these things into account. I think generally speaking, IT band related treatment is going to consist of us making sure we train your quadriceps really well, eccentrically as well as concentrically. We're going to train your lateral hip muscles quite a bit. And I think a lot of times we forget about what the foot and ankle are doing. A lot of times the foot and ankle create things upstream, and we forget about what's going on with the foot and ankle that may contribute to IT band pain. So we have to address those things. And then we want to watch you run. If there's this, kind of heavy crossover pattern with your feet where, you're crossing side to side with your feet, it's a kind of a simple cue where we want you to create some width in between your feet to offload your IT band a little bit. And then if you are rehabbing from an IT band injury, you probably would do well to start on an incline. So maybe you do start on a treadmill. It just decreases the force of the quadricep and the knee flexion angle a little bit. So you may start uphill and then progress to flat ground.
Did you say most people? So I've heard people experience IT band pain by their knee, but I've also heard at their lateral hip. What do you guys normally see?
I think we see both, right? Yeah. And I think you're dealing with kind of the same. It's the same tissue, just in a different location of where it's creating the pressure at, or the compression at. Lateral hip, I think you can differential diagnose it. Is it a ischial bursitis? Is it a bursitis on the lateral portion of the hip? But that's running underneath like the tissue that eventually turns into the IT band right there. Down by the knee, a lot of time that's one of those deals where the knee, for all intents and purposes, is a pretty simple joint, right? It's hinges back and forth. It has a little bit of rotational stuff, but for the most part, it's just a hinge. So you look above or below the joint, upstream or downstream, to see what's going on there. And with runners, I think a lot of times looking at the foot is probably where I'm gonna start at there. But in terms of where we see it the most, I'd say it's about even for me. Personally, one of the ways that I'll tend to get in there, you'd mentioned like the gait analysis, Niraj, and looking for that crossover pattern. Kind of what I'm looking for a lot of times in that gait analysis is how much actual like spring does someone kind of have, right? Are they kind of bounce off of the ground, or is it more are they just kind of shuffling the feet forward? And what that's kind of telling me there is if someone's just basically just kind of shuffling and puttering, you're just pulling at kind of the top of that hip up there, and that just creates this disconnect or this imbalance where we start pulling that IT band forward a little bit more, which can then translate a little bit further down the hip. So for me, I want to see someone that's really creating that spring out of the Achilles, absorbing energy, expending it. They've got some good posterior chain activation that's propelling them forward, type of deal that I would want to see out of someone that's dealing with an IT band issue.
Yeah, I would say a common thing amongst a lot of runners, and probably me last year, because it was the first time I did heart rate training. So I had to slow down my gait. And I think I was just really lazily running. And I think I was shifting more laterally versus engaging my buttock.
Yep.
So all that force,
sure.
20 miles in is just going on your hips instead of your butt where it's supposed to go. Yeah. So I think that's what causes a lot of like IT band syndrome and lateral hip pain in runners.
Yeah, for sure. Running is, you think, okay, I'm just going on there. That's the plane that I need to train in. And like I said, you have these muscles on the outside of your hips. Niraj mentioned it earlier, the hip abductors, lateral muscles that's keeping your pelvis level. And so if those get weak and pelvis lifts up on one side, and all of a sudden your knee's taking this sharp angle to the inside, that's going to put more compression both up at the top of the hip and down at the bottom as well, right? So you're absolutely right that's one of those root causes that needs to be fixed. And again, going back to the foam rolling conversation of is it right or wrong? I think it can be, if it's being used to help with some acute pain that allows you to decrease pain so that you can go and work your muscle in a larger range of motion to fix a root cause, then I think that's a great way of utilizing it. But if you're using it as kind of the way to cure your IT band pain, it's probably not going to be very effective in the long run or the long term.
Right. Yeah. That your explanation makes perfect sense, because after my last marathon last year, I did 2. Bob checked me out and my pelvis was elevated on that painful side. So then, I'm stretching it out. And now it's a lot better. Plus, I'm not running like that much anymore. But yeah, it's all linked.
Yeah.
Which is it's kind of sad, because a lot of people like you and other PTs been working with are looking at the body as a whole instead of like just treating individual areas.
Yeah, I think it's in the questions too is once we see somebody in clinic, so somebody checked you out after the marathon, is your pelvis elevated because in response to some of the pain you were having, and there's some compensatory shift or pattern because of the pain, or did that lead to the pain? And sometimes we don't know because we didn't have it before and after, right? But we get to treat what we see, and so you do attack it, you do adjust it, and usually that's lateral hip. And I think to touch on like shuffling versus springiness, I think we have to be like also very careful what we relate cadence to in terms of springiness or shuffling, because some athletes, who myself not included, who just are very athletic or came from a different background that are running, that you just see them and they're just like, they're almost like jumping along and are just have a lot of this, like what RT talked about, kind of this up and down, but it's not coming from just their calf, but they've got a very low cadence versus somebody who's shuffling and has a higher cadence. I think I say that to mean cadence, a higher cadence typically will offload the knee. So we don't want somebody like bouncing up and down crazy, but we do want somebody who isn't also just dragging their feet and has no flight time, right? So there has to be this kind of in between, which is what I think RT was getting at too.
It is.
Yeah, and you're talking about more like people that translate vertically versus forward, propelling themselves running, right?
That's what I'm.
Yeah.
That's the point I was trying to make, is someone who's propelling forward versus someone who's bouncing up and down.
You guys want to mention your website and where people can find you on social media quick before we get too in depth here?
Sure. Our website is thestrideshop.com. We've got blogs and some free resources and a newsletter that we think is cool. And we've also got an online course called video series called Building a Resilient Runner that we think stuffs a ton of information into some 10-minute segments that can be helpful for runners of all abilities. And then social media, we are at The Stride Shop on Instagram and The Stride Shop on Facebook.